The FDA says this pill may lower a vitamin your brain and nerves cannot survive without. More than 100 million people take it every day. Most have never been told to check. There are more than 37 million people with diabetes in the United States alone. And for most of them, one medication comes first, before insulin, before anything else, metformin. It is the most widely prescribed diabetes drug in the world. It lowers blood sugar, it reduces insulin resistance, it has decades of evidence behind it. And for most people with type 2 diabetes, it works. But there is something that happens quietly inside the body over months and years of taking this pill. Something the FDA label mentions directly. Something that was first documented in the medical literature as far back as 1969. And something that, even today, millions of people on this medication have never had explained to them. To understand what metformin does to the body over time, you need to understand one thing about how it works. Metformin does not replace insulin. It makes the body more sensitive to the insulin it already produces, and it slows down the amount of glucose your liver releases into the blood. Less glucose flooding the system, more stable blood sugar, less strain on the pancreas. For someone managing type 2 diabetes, that is genuinely valuable. The problem is not what metformin does to glucose. The problem is what it does to something else. Something that travels through the digestive system on a very specific path and needs a very specific environment to be absorbed. That something is vitamin B12. Vitamin B12 is not optional. Your body cannot make it on its own. It has to come from food, meat, fish, eggs, dairy. And once it arrives in the digestive system, it goes through a precise multi-step process to be absorbed. In the stomach, special cells produce a protein called intrinsic factor. That protein binds to B12 and carries it safely through the digestive tract. At the very end of the small intestine, a section called the terminal ileum, special receptors grab the intrinsic factor and pull the B12 into the bloodstream. Those receptors are activated by calcium. They need calcium to open, to function, to complete the job. Without that calcium signal, the door stays closed. The B12 passes through and exits the body unused. And here is where metformin enters the story. Research has found that metformin interferes with those calcium-dependent receptors at the end of the small intestine. It does not destroy them. It does not close them permanently, but it makes them less responsive to the calcium signal that tells them to open. So with every dose of metformin, several times a day, every day, the final step of B12 absorption becomes slightly less efficient. Not enough to notice in a week, not enough to notice in a month, but over a year, over 3 years, over 10 years of daily use. The disruption accumulates, and B12 levels in the blood begin to fall, slowly, silently, without any obvious warning sign. The FDA label for metformin states this directly. It warns that metformin may lower vitamin B12 levels. It recommends measuring B12 levels at 2 to 3 year intervals in patients on long-term therapy. A study published in the medical literature and involving over 1,000 patients followed for up to 13 years found that low vitamin B12 levels occurred at a significantly higher rate in the metformin group compared to those not taking the medication. A separate study found that taking metformin for 4 years was associated with a mean decrease in vitamin B12 concentration of almost 20%. In 2022, the UK Medicines Regulatory Authority officially classified low B12 as a common side effect of metformin, meaning it affects up to 1 in 10 people taking the drug. Up to 1 in 10. That is not a rare complication. That is a documented, measurable consequence of how the medication works in the body over time. If someone you love takes this medication every day and has started to feel things they cannot quite explain, keep watching. What comes next is what most people on metformin are never told. So what does low B12 actually do to a person? B12 is not just one thing. It is involved in 3 processes that are all critical and all different. The first is nerve health. B12 maintains the protective covering around your nerve fibers. Think of each nerve as a wire carrying electrical signals through your body. That wire has insulation around it, a fatty sheath that keeps the signal clean and moving in the right direction. B12 helps build and maintain that insulation. When B12 levels drop over months and years, the insulation begins to thin. Signals become unreliable. They leak. They misfire. The first signs usually appear in the hands and feet, the nerves farthest from the spine, and the first ones affected when the insulation deteriorates. Tingling, numbness, a sensation like pins and needles that comes without explanation. Over time, it can progress to burning pain, weakness in the grip, loss of coordination when walking. This condition is called peripheral neuropathy, and it is one of the most common and feared complications of diabetes itself, which creates a situation that is almost impossible to untangle without a blood test. Many people on metformin for diabetes are already being monitored for peripheral neuropathy caused by high blood sugar, and the symptoms of B12 deficiency are nearly identical. So when the tingling starts, it is almost always attributed to the diabetes, not to the medication taken every day to manage it. The connection is rarely made. The B12 test is rarely ordered. The second process is brain function. B12 is essential for producing the chemicals your brain uses to communicate between cells. When B12 falls, memory begins to slip. Concentration becomes harder. Words that used to come easily start taking longer to find. Fatigue sets in that sleep does not resolve. In older adults, these symptoms are routinely attributed to aging. But in a person who has been on metformin for 5 or 10 years with declining B12, the aging and the deficiency are happening at the same time. And without a blood test, there is no way to separate them. The third process is blood. B12 is essential for producing healthy red blood cells. Red blood cells carry oxygen through the body, to the muscles, the brain, the organs. Every single cell depends on that delivery. When B12 is low, red blood cells cannot form properly. Instead of being small and efficient, they become large, misshapen, and unable to carry oxygen effectively. The result is a type of anemia called megaloblastic anemia. Not from low iron, not from poor diet alone, from a vitamin that was being absorbed less and less efficiently with every passing year. Fatigue that feels bone deep, shortness of breath from ordinary activity, pale skin, weakness in the legs. These are the symptoms. And because they develop slowly, and because the person taking metformin already has a condition that causes fatigue, they are almost never connected to the medication. They are managed separately, treated as separate problems, when in reality they may all share the same root. None of this means metformin is the wrong treatment. For type 2 diabetes, it remains one of the most effective and well-studied medications available. What it means is that long-term use requires monitoring that is not always happening. For B12, the American Diabetes Association has recommended considering periodic B12 testing in patients on long-term metformin therapy. Many doctors recommend checking B12 levels annually, not every 2 to 3 years as the label suggests, especially in patients over 60, vegetarians, or anyone already showing neurological symptoms. Research commonly points to methylcobalamin, a specific form of B12, as particularly well absorbed and discussed in the context of nerve protection. Sublingual B12, tablets that dissolve under the tongue, is widely discussed as an option that bypasses the absorption problem in the digestive system entirely. For anyone already showing signs of neuropathy, many clinicians recommend not waiting for a deficiency to become severe before discussing supplementation with a doctor. And the question's worth bringing to the next appointment. When was my B12 last tested, and what was the actual number? Do I have any symptoms that could be related to low B12? Is the dose of metformin I am on the lowest effective dose for my current blood sugar levels? These are not challenging questions. They are what someone who understands their medication asks, and a good doctor will welcome them. If this changed how you think about a medication someone you love takes every day, subscribe to Med Truths. Every week we read the label so you know what to ask. Here is the truth about metformin. It is one of the most important tools available for managing type 2 diabetes. It has been taken by hundreds of millions of people around the world. It works. It reduces blood sugar. It reduces cardiovascular risk. It has earned its place as the first prescription most diabetic patients receive, but it works by changing something in the digestive system. And that change quietly reduces the absorption of a vitamin. Your nerves, your brain, and your blood all depend on to function properly. That is not hidden information. The FDA says to monitor B12 every 2 to 3 years. The research says the connection between metformin and B12 absorption was first documented in 1969, more than 50 years ago. Most patients taking this medication today have never heard that sentence. It is in the label. It has always been there. You just needed someone to read it out loud.